Question 1. Performance analysis shows a patient prescribed aripiprazole for bipolar disorder reports a significant decline in their ability to concentrate and recall recent events. The master psychopharmacologist is tasked with evaluating the impact of the psychotropic medication on the patient's cognitive function. Which of the following approaches best reflects best practice in this situation? Option A. Rely solely on the patient's subjective report of cognitive difficulties to adjust the medication dosage. Option B. Conduct a comprehensive cognitive assessment. Review the patient's medication regimen for potential cognitive side effects of aripiprazole and investigate other potential causes of cognitive impairment. Option C. Attribute all reported cognitive changes to the underlying bipolar disorder without further investigation into medication effects. Option D. Immediately discontinue aripiprazole and monitor for improvement in cognitive function. Correct answer is B. Conduct a comprehensive cognitive assessment. Review the patient's medication regimen for potential cognitive side effects of aripiprazole and investigate other potential causes of cognitive impairment. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the master psychopharmacologist, MP, to balance the therapeutic benefits of psychotropic medication with potential cognitive side effects. The MP must critically evaluate the patient's subjective report of cognitive decline against objective clinical observations and established pharmacological principles. The challenge lies in discerning whether the reported cognitive changes are a direct consequence of the medication, a symptom of the underlying psychiatric condition, or influenced by other factors. This necessitates a nuanced understanding of psychopharmacology and its impact on various cognitive domains, as well as strong clinical judgment to differentiate between drug-induced effects and illness progression. Correct approach analysis. The correct approach involves a comprehensive, multifaceted evaluation. This includes a detailed medication review to assess dosage, duration, and potential for cognitive side effects based on the specific drug class and individual patient factors. It also necessitates a thorough cognitive assessment, which may involve standardized neuropsychological testing to objectively measure specific cognitive domains, e.g., memory, attention, executive function. Furthermore, ruling out other potential causes of cognitive impairment, such as comorbid medical conditions, substance use, or sleep disturbances, is crucial. This systematic, evidence-based approach aligns with best practices in psychopharmacology, emphasizing patient safety, efficacy, and a holistic understanding of the patient's presentation. It adheres to the ethical imperative of providing competent care and acting in the patient's best interest, as guided by professional standards and regulatory expectations for master psychopharmacologists. Incorrect approaches analysis. One incorrect approach would be to solely rely on the patient's subjective report without objective verification. This fails to acknowledge the potential for anosognosia, medication side effects mimicking cognitive decline, or other contributing factors. Ethically, this approach risks misdiagnosis and inappropriate treatment adjustments, potentially harming the patient by either continuing a medication, causing significant impairment, or discontinuing unnecessary treatment without adequate justification. Another incorrect approach would be to immediately discontinue the medication based on the patient's report without a thorough assessment. This disregards the potential benefits of the medication for the underlying psychiatric condition and could lead to relapse or worsening of symptoms. It also bypasses the professional obligation to conduct a systematic evaluation before making significant treatment changes, which is a failure of due diligence and professional responsibility. A third incorrect approach would be to attribute all cognitive changes solely to the psychiatric illness without considering the medication's role. While psychiatric conditions can impact cognition, many psychotropic medications also have known cognitive side effects. Failing to consider this interaction is a failure to apply comprehensive psychopharmacological knowledge and can lead to suboptimal treatment strategies. Professional reasoning. When faced with a patient reporting cognitive changes while on psychotropic medication, a master psychopharmacologist should employ a structured decision-making process. This begins with active listening and a detailed history, followed by a comprehensive clinical examination. The next step involves a systematic review of the medication regimen, considering known side effect profiles and potential drug interactions. Objective cognitive assessment. through standardized testing or validated screening tools is essential to quantify the reported deficits. Crucially, differential diagnosis is paramount. All other potential causes of cognitive impairment must be investigated and ruled out. Based on this integrated assessment, a treatment plan can be formulated, which may involve dose adjustment, switching medications, adding adjunctive therapies, or implementing cognitive remediation strategies, always prioritizing patient safety and therapeutic efficacy. Question 2. The risk matrix shows a high probability of relapse and potential for self-harm if antipsychotic medication is discontinued, yet the patient expresses a strong desire to stop treatment due to perceived side effects impacting their quality of life. As a master psychopharmacologist, what is the most ethically and professionally sound course of action? Option A. Immediately discontinue the antipsychotic medication as requested by the patient to respect their autonomy, assuming their desire to stop outweighs the documented risks of relapse. Option B. Insist on the continuation of the current antipsychotic medication without further discussion, citing the high risk of relapse and potential harm as outlined in the risk matrix, and inform the patient that their request cannot be accommodated. Option C. Refer the patient to a different specialist without further engagement, stating that their treatment preferences are not aligned with the clinical risk assessment. Option D. Engage in a detailed discussion with the patient about their concerns regarding side effects, explore alternative medication options or adjunctive treatments to manage side effects, and collaboratively develop a plan that addresses both their desire to reduce medication burden and the clinical imperative to maintain stability, while thoroughly documenting the shared decision-making process. The correct answer is D. Engage in a detailed discussion with the patient about their concerns regarding side effects, explore alternative medication options or adjunctive treatments to manage side effects, and collaboratively develop a plan that addresses both their desire to reduce medication burden and the clinical imperative to maintain stability, while thoroughly documenting the shared decision-making process. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed wishes and the clinician's assessment of their best interests, particularly when considering the potential for relapse and harm. The master psychopharmacologist, MP, must navigate this ethical tightrope, balancing patient autonomy with the duty of care, all within the established regulatory framework for psychopharmacological practice. The risk matrix in this context highlights the potential negative outcomes associated with both continuing and discontinuing the antipsychotic medication, necessitating a nuanced and evidence-based decision. The correct approach represents best professional practice because it prioritizes a collaborative and informed decision-making process. It involves a thorough reevaluation of the patient's condition, a detailed discussion of risks and benefits, and an exploration of alternative strategies. This aligns with ethical principles of beneficence, acting in the patient's best interest, non-maleficence, avoiding harm, and respect for autonomy. Regulatory guidelines for MP practice emphasize the importance of patient-centered care, shared decision-making, and the judicious use of psychotropic medications, particularly when considering changes to established treatment regimens. This approach ensures that any decision is made with the patient's full understanding and consent, or with appropriate safeguards in place if capacity is compromised. An incorrect approach that involves unilaterally discontinuing the medication without further assessment or discussion would represent a failure to uphold the duty of care and respect patient autonomy. It could lead to a relapse, potentially causing significant harm to the patient and others, and would be a breach of professional standards that require careful consideration of treatment changes. Another incorrect approach, such as coercing the patient into continuing the medication against their wishes without a clear and documented assessment of their capacity to make such a decision, would violate the principle of autonomy and could lead to a breakdown in the therapeutic relationship. This also fails to adhere to regulatory requirements that mandate informed consent and the assessment of decision-making capacity. A third incorrect approach, focusing solely on the patient's stated desire without adequately considering the objective clinical evidence of potential relapse and its consequences, would be a failure of beneficence and could lead to a worse outcome for the patient. The professional decision-making process for similar situations should involve a systematic approach. First, a comprehensive assessment of the patient's current clinical status, including symptom severity, functional impairment, and any signs of impending relapse. Second, a thorough discussion with the patient about their concerns, their understanding of their illness, and their treatment preferences. Third, a clear articulation of the risks and benefits associated with continuing, discontinuing, or modifying the current medication regimen, presented in a way that the patient can understand. Fourth, an assessment of the patient's capacity to make decisions about their treatment. If capacity is intact, shared decision-making is paramount. If capacity is impaired, the process must involve appropriate legal and ethical safeguards, potentially including consultation with a surrogate decision-maker or ethics committee, while still striving to involve the patient to the greatest extent possible. Finally, all discussions and decisions must be meticulously documented in the patient's record. Question 3. Analysis of a situation where a patient, diagnosed with major depressive disorder, expresses a strong desire to manage their antidepressant prescription independently, including self-adjusting the dosage based on their perceived symptom severity and avoiding regular follow-up appointments, presents a complex ethical and clinical challenge for a master psychopharmacologist. What is the most appropriate course of action for the clinician in this scenario? Option A. Agree to the patient's request to self-manage the dosage and avoid regular appointments, but secretly document in the patient's chart that the prescription is being provided against professional judgment due to patient insistence. Option B. Prescribe the antidepressant as requested but provide minimal instructions, assuming the patient will adhere to standard guidelines and manage any side effects independently, and schedule a follow-up appointment 6 months later. Option C. Conduct a thorough assessment of the patient's capacity for informed decision-making regarding their medication. Engage in a detailed discussion about the risks and benefits of the prescribed antidepressant, and collaboratively develop a treatment plan that includes clear monitoring strategies and contingency plans for symptom fluctuations or adverse events. Option D. Immediately refuse to prescribe the antidepressant, citing the patient's expressed desire to self-manage as a contraindication to responsible pharmacotherapy, and suggest they seek alternative, non-pharmacological interventions. The correct answer is C. Conduct a thorough assessment of the patient's capacity for informed decision-making regarding their medication. Engage in a detailed discussion about the risks and benefits of the prescribed antidepressant, and collaboratively develop a treatment plan that includes clear monitoring strategies and contingency plans for symptom fluctuations or adverse events. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed wishes and the clinician's professional judgment regarding the most appropriate treatment. The patient's desire to self-manage medication, particularly an antidepressant, raises concerns about adherence, potential for adverse effects without monitoring, and the risk of treatment failure or relapse. The clinician must balance patient autonomy with the duty of care and the principles of beneficence and non-maleficence. Correct approach analysis. The correct approach involves a thorough assessment of the patient's capacity to make informed decisions about their treatment, a detailed discussion about the risks and benefits of the proposed antidepressant, and the development of a collaborative treatment plan that includes clear monitoring strategies and contingency plans. This aligns with ethical principles of informed consent and patient-centered care, ensuring the patient understands the rationale for the prescription and the importance of adherence and follow-up. It also adheres to professional guidelines that mandate a comprehensive evaluation before prescribing psychotropic medications and the establishment of a therapeutic alliance. Incorrect approaches analysis. One incorrect approach would be to immediately refuse the prescription solely based on the patient's request to self-manage, without a thorough assessment of their capacity or exploring their reasoning. This disregards patient autonomy and the potential for a collaborative solution, potentially damaging the therapeutic relationship and leading to patient disengagement from care. It fails to uphold the principle of shared decision-making. Another incorrect approach would be to prescribe the antidepressant without adequately discussing the risks, benefits, and the importance of adherence and monitoring. This constitutes a failure in the informed consent process and a breach of the duty of care, as it does not ensure the patient is equipped to manage the medication safely and effectively. It risks patient harm due to potential non-adherence or unmanaged side effects. A third incorrect approach would be to dismiss the patient's concerns about side effects without a proper discussion or exploration of alternative strategies. This can lead to patient distrust and a reluctance to report adverse events, hindering effective treatment management, and potentially leading to the discontinuation of a beneficial medication. Professional reasoning. Professionals should approach such situations by first assessing the patient's capacity for informed consent. This involves understanding their reasoning, their comprehension of the condition and treatment options, and their ability to weigh risks and benefits. Following this, a collaborative discussion should occur, where the clinician explains the rationale for the recommended treatment, potential side effects, and the importance of adherence and monitoring. Shared decision-making, where the patient and clinician work together to formulate a treatment plan, is paramount. This plan should include clear expectations, regular follow-up appointments, and strategies for managing potential challenges, thereby fostering trust and ensuring optimal patient outcomes. Question 4. Stakeholder feedback indicates a patient experiencing persistent depressive symptoms, who has expressed a strong desire for rapid symptom relief, is being considered for treatment with a serotonin norepinephrine reuptake inhibitor, SNRI. The patient's caregiver has voiced concerns regarding potential side effects, and the prescribing physician has provided an initial recommendation for a specific SNRI. As a master psychopharmacologist, MP, what is the most appropriate course of action to ensure optimal and safe treatment? Option A. Immediately prescribe the SNRI recommended by the physician to address the patient's expressed desire for rapid symptom relief. Option B. Focus solely on the patient's request for rapid relief, downplaying the caregiver's concerns about side effects to avoid unnecessary patient anxiety. Option C. Accept the prescribing physician's recommendation without further independent review, assuming their judgment is sufficient given the patient's expressed desire. Option D. Conduct a thorough clinical assessment of the patient, critically evaluating the evidence for SNRI efficacy and safety in their specific presentation, considering potential side effects and contraindications, and engaging in shared decision-making with the patient and caregiver. The correct answer is D. Conduct a thorough clinical assessment of the patient, critically evaluating the evidence for SNRI efficacy and safety in their specific presentation, considering potential side effects and contraindications, and engaging in shared decision-making with the patient and caregiver. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the master psychopharmacologist, MP, to navigate conflicting stakeholder priorities regarding the management of a patient's treatment. The patient's desire for rapid symptom relief, coupled with the caregiver's concerns about potential side effects and the prescribing physician's adherence to evidence-based guidelines, creates a complex decision-making environment. The MP must balance the immediate needs of the patient with long-term well-being and regulatory compliance, all while maintaining professional objectivity. Correct approach analysis. The correct approach involves a comprehensive, individualized assessment of the patient's clinical presentation, medical history, and previous treatment responses. This aligns with the core principles of evidence-based practice and patient-centered care, which are paramount in psychopharmacology. The MP must critically evaluate the efficacy and safety profile of SNRI in the context of the specific patient's condition, considering potential drug interactions and contraindications. This approach ensures that treatment decisions are informed by the latest scientific literature and regulatory guidelines, prioritizing patient safety and optimal therapeutic outcomes. Adherence to the master psychopharmacologist, MP, examination's regulatory framework, which emphasizes a thorough understanding of drug mechanisms, efficacy, and side effect profiles, is essential. Incorrect approach is analysis. One incorrect approach would be to solely prioritize the patient's immediate request for a specific medication without a thorough clinical evaluation. This fails to adhere to the MP's professional responsibility to conduct a comprehensive assessment, potentially leading to inappropriate prescribing and adverse events. It disregards the regulatory requirement for evidence-based decision-making and patient safety. Another incorrect approach would be to dismiss the patient's concerns about side effects without adequate discussion or exploration of mitigation strategies. This demonstrates a lack of empathy and patient-centeredness, which are critical ethical considerations. It also fails to acknowledge the known side effect profiles of SNRI and the importance of patient education and monitoring. A third incorrect approach would be to exclusively rely on the prescribing physician's initial recommendation without independent critical appraisal. While collaboration is important, the MP's role is to provide expert, objective analysis. Over-reliance on another's opinion without due diligence can lead to perpetuating suboptimal treatment or overlooking potential risks, violating the MP's duty of independent professional judgment. Professional reasoning. Professionals should approach such situations by first gathering all relevant information, including patient history, current symptoms, previous treatments, and stakeholder concerns. This is followed by a critical review of the scientific literature and relevant regulatory guidelines pertaining to the class of medications in question, SNRI. The MP should then synthesize this information to formulate an individualized treatment plan that balances efficacy, safety, and patient preferences. Open communication with the patient, caregiver, and prescribing physician is crucial to ensure shared decision-making and adherence. The decision-making process should be documented thoroughly, outlining the rationale for the chosen course of action and any alternatives considered. Question 5. Strategic planning requires a comprehensive understanding of patient history and medication profiles when managing a relapse of psychosis. A 45-year-old male patient with a diagnosis of schizophrenia is presenting with increased auditory hallucinations and disorganized thinking, indicating a relapse. His medical history includes a previous diagnosis of tardive dyskinesia, TD, that partially resolved after discontinuation of a high-potency first-generation antipsychotic, FGA, 5 years ago. He is currently stable on a low-potency FGA, but expresses significant anxiety about any medication that might increase his risk of TD. Given this history and his current presentation, which of the following represents the most appropriate initial pharmacotherapeutic strategy? Option A. Initiate a high-potency first-generation antipsychotic known for its strong dopamine D2 receptor blockade, with close monitoring for EPS. Option B. Increase the dose of the current low-potency first-generation antipsychotic to achieve rapid symptom control, given his history of partial response. Option C. Continue the current low-potency first-generation antipsychotic, as it has not exacerbated his TD previously, and consider adding adjunctive non-pharmacological interventions. Option D. Switch to a second-generation antipsychotic, SGA, with a lower affinity for D2 receptors and a broader receptor binding profile, which is generally associated with a lower risk of EPS and TD. The correct answer is A. Initiate a high-potency first-generation antipsychotic known for its strong dopamine D2 receptor blockade, with close monitoring for EPS. Explanation. This scenario presents a common clinical challenge involving the management of a patient with a chronic mental health condition who is experiencing a relapse. The core difficulty lies in balancing the need for effective symptom management with the potential for significant adverse effects associated with first-generation antipsychotics, FGA. The patient's history of tardive dyskinesia, TD, adds a critical layer of complexity, as FGAs are known to increase the risk of developing or exacerbating this movement disorder. Professional judgment is required to select an antipsychotic that offers the best chance of symptom control while minimizing the risk of irreversible side effects, considering the patient's unique pharmacogenetic profile and past treatment responses. The correct approach prioritizes patient safety and adherence to established clinical guidelines for managing psychosis in individuals with a history of movement disorders. It involves selecting an antipsychotic with a lower propensity for extrapyramidal symptoms, EPS, which are often precursors to TD, and considering agents that have demonstrated efficacy in managing positive symptoms of schizophrenia. This approach aligns with the principle of do no harm and reflects a thorough understanding of the pharmacodynamics and pharmacokinetics of FGAs, particularly their dopamine D2 receptor blockade, which is implicated in EPS and TD. Furthermore, it emphasizes shared decision-making with the patient, ensuring informed consent and consideration of their preferences and concerns regarding potential side effects. This aligns with ethical principles of autonomy and beneficence. An incorrect approach would be to prescribe a high-potency FGA without adequately considering the patient's history of TD. This would represent a failure to apply knowledge of drug-specific risks and a disregard for the patient's vulnerability. Such an action could lead to the development or worsening of TD, causing significant distress and potentially irreversible disability, thereby violating the ethical principle of non-maleficence. Another incorrect approach would be to avoid all antipsychotic treatment despite clear signs of relapse, opting instead for non-pharmacological interventions alone. While these can be valuable adjuncts, they are often insufficient for managing acute psychotic symptoms, potentially leading to prolonged suffering, functional decline, and increased risk of harm to self or others, thus failing to meet the ethical obligation of beneficence. A third incorrect approach might involve switching to another FGA with a similar risk profile for EPS without a clear rationale or a plan to monitor for TD development, demonstrating a lack of nuanced understanding of the different FGAS risk profiles and a failure to implement proactive risk mitigation strategies. A professional decision-making process for similar situations should involve a systematic assessment of the patient's current symptoms, past treatment history, including efficacy and adverse events, comorbidities, and personal preferences. A thorough review of the current evidence-based guidelines for managing psychosis, with a specific focus on agents with favorable side effect profiles for patients at risk of movement disorders, is essential. This should be followed by a discussion with the patient about the risks and benefits of available treatment options, empowering them to participate in the decision-making process. Continuous monitoring for efficacy and adverse events, with a low threshold for adjusting treatment or switching to alternative drug classes if necessary, is paramount. Question 6. Research into a novel class of psychotropic agents, purportedly acting via a unique glutamatergic modulation pathway, has gained some traction in fringe scientific circles. A patient, who has been stable on their current SRI regimen for several years, but expresses a desire for cutting-edge treatment, requests a prescription for one of these experimental agents, citing anecdotal online reports of rapid symptom remission. As a master psychopharmacologist, how should you ethically and professionally address this request, considering the limited peer-reviewed data and potential for off-label use? Option A. Prescribe the requested experimental agent immediately, given the patient's expressed desire for novel treatment and the potential for rapid symptom remission, to foster patient satisfaction and explore emerging therapeutic avenues. Option B. Recommend a placebo-controlled trial of the experimental agent, as this is the most rigorous way to assess its efficacy, even if the patient is currently stable on an effective treatment. Option C. Conduct a comprehensive literature review on the proposed glutamatergic modulators, assess their preclinical and early clinical data for efficacy and safety, discuss the findings transparently with the patient, and explore evidence-based alternatives if the proposed agents are not supported by robust data. Option D. Inform the patient that their request is based on unsubstantiated claims and firmly refuse to consider any treatment outside of established, FDA-approved medications without further investigation. The correct answer is C. Conduct a comprehensive literature review on the proposed glutamatergic modulators, assess their preclinical and early clinical data for efficacy and safety, discuss the findings transparently with the patient, and explore evidence-based alternatives if the proposed agents are not supported by robust data. Explanation. This scenario presents a professional challenge due to the inherent conflict between a clinician's duty to provide evidence-based care and the patient's expressed desire for a treatment that may not align with current best practices or established pharmacological understanding. The Master Psychopharmacologist, MP, designation implies a high level of expertise, necessitating a nuanced approach that prioritizes patient safety and efficacy while respecting patient autonomy. The core of the challenge lies in navigating the ethical imperative to avoid harm, non-maleficence, and promote well-being, beneficence, when faced with a patient's potentially misinformed or unproven treatment preference. The correct approach represents best professional practice by prioritizing a thorough assessment of the patient's request within the established scientific and regulatory framework. This involves understanding the proposed drug class and its proposed mechanism, critically evaluating the available evidence, or lack thereof, for its efficacy and safety in the patient's specific condition, and engaging in open, informed dialogue with the patient. This approach aligns with the ethical principles of informed consent and shared decision-making, ensuring the patient's treatment plan is grounded in scientific validity and regulatory compliance. It upholds the MP's responsibility to provide care that is both effective and safe, as dictated by the principles of psychopharmacology and professional conduct. An incorrect approach would be to immediately dismiss the patient's request without a proper evaluation. This fails to acknowledge the patient's autonomy and can erode the therapeutic alliance. Furthermore, It bypasses the crucial step of critically assessing the proposed drug class and mechanism, potentially overlooking novel but underdeveloped research or misinterpreting existing data. Another incorrect approach would be to accede to the patient's request without due diligence, prescribing a medication based solely on patient preference without a sound scientific rationale. This violates the principle of beneficence and could lead to patient harm due to ineffectiveness or adverse effects, and potentially contravenes regulatory guidelines that mandate evidence-based prescribing. A third incorrect approach might involve a condescending or dismissive attitude, which is ethically unacceptable and undermines the patient's trust and willingness to engage in their treatment. The professional decision-making process for similar situations should involve a structured approach. 1. Active listening and empathy. Understand the patient's rationale and concerns behind their request. 2. Information gathering. Thoroughly research the proposed drug class and mechanism, assessing the strength of scientific evidence, potential risks, and contraindications. 3. Risk-benefit analysis. Objectively evaluate the potential benefits versus risks of the proposed treatment in the context of the patient's specific condition and history. 4. Informed dialogue. Clearly communicate findings to the patient, explaining the scientific basis for recommendations, addressing their questions, and discussing alternative evidence-based treatment options. 5. Collaborative decision-making. Work with the patient to arrive at a mutually agreed-upon treatment plan that is both safe and effective, adhering to professional standards and regulatory requirements. Question 7. The audit findings indicate a pattern of prescribing second-generation antipsychotics, SGA, where the primary focus appears to be on achieving symptom remission, with less emphasis on proactive, individualized metabolic monitoring. Considering the known risks associated with SGAs, which of the following approaches best aligns with current best practices for risk assessment and management in this context? Option A. Focus exclusively on the efficacy of the SGA in managing psychotic symptoms, assuming that metabolic side effects are an unavoidable consequence that patients must manage independently. Option B. Rely primarily on patient self-reporting of any perceived side effects, with metabolic monitoring only initiated if the patient expresses significant concerns about weight gain or other physical changes. Option C. Implement a comprehensive, individualized metabolic monitoring plan that includes baseline assessments and regular follow-ups for weight, waist circumference, blood pressure, glucose and lipid profiles, tailored to the specific SGA and patient risk factors. Option D. Utilize a standardized, one-size-fits-all metabolic monitoring schedule for all patients on SGAs, regardless of individual risk factors or the specific medication prescribed. The correct answer is C. Implement a comprehensive, individualized metabolic monitoring plan that includes baseline assessments and regular follow-ups for weight, waist circumference, blood pressure, glucose, and lipid profiles, tailored to the specific SGA and patient risk factors. Explanation. The audit findings indicate a potential deviation from best practices in managing patients prescribed second-generation antipsychotics, SGA. This scenario is professionally challenging because it requires a nuanced understanding of SGA mechanisms, efficacy, and side effect profiles, coupled with a proactive risk assessment approach to patient care. The challenge lies in balancing the therapeutic benefits of SGAs against their significant metabolic and other adverse effects, and ensuring that monitoring protocols are robust and individualized. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established clinical guidelines and regulatory expectations for pharmacovigilance. By systematically assessing individual patient risk factors for metabolic complications and implementing a tailored monitoring plan, the clinician is demonstrating a commitment to evidence-based practice and minimizing potential harm. This aligns with the ethical imperative to do no harm and the professional responsibility to stay abreast of evolving knowledge regarding psychotropic medications. Regulatory frameworks, such as those governing the practice of medicine and pharmacy, emphasize the importance of ongoing patient assessment and risk management for all prescribed medications, particularly those with known significant side effect profiles like SGAs. An incorrect approach that focuses solely on symptom remission without adequate metabolic monitoring fails to meet professional standards. This represents a regulatory and ethical failure because it neglects the known risks associated with SGAs, such as weight gain, dyslipidemia, and hyperglycemia, which can lead to serious long-term health consequences, including cardiovascular disease and diabetes. Such an approach could be seen as a breach of the duty of care, as it prioritizes immediate symptomatic relief over comprehensive patient well-being. Another incorrect approach that relies on generic, non-individualized monitoring schedules overlooks the principle of personalized medicine. This is a regulatory and ethical failure because it fails to account for varying patient susceptibilities and the specific risk profiles of different SGAs. Best practice dictates that monitoring should be guided by individual patient characteristics, family history, and the specific agent being used. A third incorrect approach that delegates all monitoring responsibilities to the patient without clear instructions or follow-up is also professionally unacceptable. This constitutes a regulatory and ethical failure, as it abdicates the clinician's responsibility for ensuring adequate oversight and patient support, potentially leading to misdiagnoses of adverse effects and delayed interventions. The professional decision-making process for similar situations should involve a thorough initial assessment of the patient's medical history, family history of metabolic disorders, and current lifestyle factors. This should be followed by an informed discussion with the patient about the potential benefits and risks of the prescribed SGA, including the necessity of regular monitoring. A personalized monitoring plan should be developed, incorporating baseline assessments and regular follow-ups to track weight, waist circumference, blood pressure, glucose levels, and lipid profiles, as indicated by clinical guidelines and the specific SGA prescribed. This proactive and individualized approach ensures that potential adverse effects are identified and managed promptly, thereby optimizing patient outcomes and adhering to professional and regulatory expectations. Question 8. The audit findings indicate a pattern of inconsistent patient monitoring for individuals prescribed anticonvulsants for mood stabilization. Which of the following approaches best aligns with the regulatory framework for master psychopharmacologists in ensuring optimal patient outcomes and safety? Option A. Focusing primarily on achieving target mood stabilization, with side effect monitoring being a secondary consideration, addressed only if it significantly impacts treatment adherence. Option B. Implementing a standardized protocol for regular laboratory monitoring of relevant anticonvulsant drug levels and potential organ toxicity markers, alongside systematic assessment of both efficacy and adverse effects at each patient encounter. Option C. Utilizing a checklist of common side effects that is reviewed with the patient annually, assuming no other specific risk factors are present. Option D. Relying on patient self-reporting of any perceived side effects, and only initiating further investigation if symptoms are severe or persistent. The correct answer is B. Implementing a standardized protocol for regular laboratory monitoring of relevant anticonvulsant drug levels and potential organ toxicity markers, alongside systematic assessment of both efficacy and adverse effects at each patient encounter. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent complexity of psychopharmacology and the critical need for accurate patient management. The audit findings highlight a potential deviation from best practices in managing patients on anticonvulsants for mood stabilization, specifically concerning the monitoring of potential adverse effects and drug interactions. The challenge lies in balancing therapeutic efficacy with patient safety, especially given the narrow therapeutic index of some anticonvulsants and the potential for serious side effects. This requires a deep understanding of the drug class, individual patient factors, and adherence to established clinical guidelines and regulatory expectations for patient care. Correct approach analysis. The correct approach emphasizes a proactive and comprehensive monitoring strategy. This aligns with the regulatory framework for master psychopharmacologists, which mandates diligent patient care, risk assessment, and adherence to evidence-based practice. Specifically, it reflects the ethical obligation to minimize harm and maximize benefit by anticipating and managing potential adverse drug reactions and interactions. This approach demonstrates a commitment to patient safety by ensuring regular assessment of efficacy and tolerability, thereby allowing for timely intervention if issues arise. This is crucial for anticonvulsants, which can have significant neurological, hematological, and hepatic side effects, and can interact with other psychotropic medications commonly prescribed. Incorrect approaches analysis. One incorrect approach might involve a reactive stance, only addressing side effects when a patient explicitly reports them. This fails to meet the regulatory expectation of proactive patient monitoring and risk management. Ethically, it constitutes a failure to uphold the duty of care, as it places the burden of identifying serious adverse events solely on the patient, who may not recognize subtle or developing symptoms. This approach also neglects the potential for serious, asymptomatic toxicity that requires laboratory monitoring. Another incorrect approach could be to solely focus on efficacy without adequately assessing side effects or potential drug interactions. This violates the principle of beneficence and non-maleficence. Regulatory frameworks for psychopharmacologists require a holistic assessment of the patient's response to medication, encompassing both positive outcomes and negative consequences. Ignoring side effects or interactions can lead to significant patient harm, including treatment failure, exacerbation of existing conditions, or the development of new, dangerous health problems. A third incorrect approach might involve relying on outdated or incomplete clinical guidelines for monitoring. This demonstrates a lack of commitment to continuous professional development and adherence to current best practices, which is often an implicit or explicit requirement within professional regulatory standards. Failure to stay abreast of evolving research and updated guidelines can lead to suboptimal patient care and potential regulatory noncompliance if patient outcomes are negatively impacted. Professional reasoning. Professionals should adopt a systematic approach to patient management. This involves 1. Thorough initial assessment including a comprehensive medical and psychiatric history and review of current medications. 2. Development of an individualized treatment plan that includes clear goals for efficacy and a schedule for monitoring potential side effects and drug interactions, informed by current evidence-based guidelines. 3. Regular, scheduled follow-up appointments to assess therapeutic response, tolerability, and adherence, incorporating both subjective patient reports and objective measures where appropriate, e.g., laboratory tests for specific anticonvulsants. 4. Proactive patient education regarding potential side effects and the importance of reporting any changes in their health status. 5. Ongoing review and updating of the treatment plan based on patient response and new clinical information. This structured approach ensures comprehensive care and minimizes the risk of adverse outcomes. Question 9. Which approach would be most appropriate for a master psychopharmacologist to explain the primary mechanism of action of a selective serotonin reuptake inhibitor, SRI, to a colleague, emphasizing its core pharmacodynamic principle? Option A. Detailing the drug's influence on the drug's half-life and its metabolic pathways in the liver. Option B. Explaining the drug's ability to cross the blood-brain barrier and its distribution within different brain regions. Option C. Describing the drug's effect on increasing extracellular serotonin levels by blocking the serotonin transporter, CERT, on presynaptic neurons, thereby enhancing serotonergic neurotransmission. Option D. Focusing on the drug's potential to bind to dopamine receptors, even if this binding is weak, and not considered its primary therapeutic target. The correct answer is C. Describing the drug's effect on increasing extracellular serotonin levels by blocking the serotonin transporter, CERT, on presynaptic neurons, thereby enhancing serotonergic neurotransmission. Explanation. This scenario presents a professional challenge due to the inherent complexity of pharmacodynamics and the need for precise application of knowledge in a clinical context. The challenge lies in discerning the most appropriate mechanism of action explanation for a specific psychotropic medication, considering the nuances of receptor binding, downstream signaling, and potential off-target effects. Careful judgment is required to avoid oversimplification or misrepresentation of the drug's effects, which could impact patient care and professional credibility. The correct approach represents best professional practice because it accurately reflects the current scientific understanding of the drug's pharmacodynamics, emphasizing the primary mechanism of action while acknowledging potential secondary effects. This aligns with the Master Psychopharmacologist, MP, exam's focus on deep analytical understanding of psychopharmacology. Providing a precise and evidence-based explanation ensures that the information conveyed is clinically relevant and supports informed decision-making regarding patient treatment. This approach upholds the professional standard of providing accurate and comprehensive information, crucial for patient safety and therapeutic efficacy. An incorrect approach that focuses solely on a single, potentially minor, receptor interaction would be professionally unacceptable. This is because it fails to capture the full spectrum of the drug's pharmacodynamic profile, potentially leading to an incomplete understanding of its therapeutic and adverse effects. Such an approach could be considered a failure to adhere to the principle of providing a comprehensive and accurate representation of scientific knowledge, a core expectation for an MP. Another incorrect approach that overemphasizes theoretical or speculative mechanisms without strong empirical support would also be professionally unacceptable. This risks misinforming oneself or others about the drug's established actions, potentially leading to inappropriate clinical judgments or research directions. This represents a departure from evidence-based practice, a cornerstone of professional conduct in psychopharmacology. A further incorrect approach that conflates pharmacodynamics with pharmacokinetics would be a significant professional failure. Pharmacodynamics describes what the drug does to the body mechanism of action, while pharmacokinetics describes what the body does to the drug, absorption, distribution, metabolism, excretion. Confusing these fundamental concepts demonstrates a lack of foundational understanding and would render any explanation of the drug's effects inaccurate and misleading. The professional decision-making process for similar situations should involve a systematic review of current pharmacological literature, focusing on peer-reviewed studies and established pharmacological principles. Professionals should prioritize explanations that are supported by robust evidence and clearly delineate primary from secondary or tertiary mechanisms of action. When in doubt, consulting authoritative pharmacological resources or seeking peer consultation is advisable. The goal is always to provide the most accurate, comprehensive, and clinically relevant explanation of a drug's pharmacodynamics. Question 10. The review process indicates that a master psychopharmacologist is presented with a complex case involving a patient exhibiting severe anxiety, persistent depressive symptoms, and significant interpersonal difficulties. The patient has a history of trauma and has not responded well to initial pharmacological interventions. The master psychopharmacologist is asked to conduct a full diagnostic assessment, including a structured clinical interview to determine the primary diagnosis and develop a comprehensive treatment plan that integrates psychotherapy and pharmacotherapy. Option A. Primarily focus on prescribing new psychotropic medications to address the anxiety and depressive symptoms, assuming that addressing the biological underpinnings will resolve the interpersonal difficulties and trauma-related issues without further specialized assessment. Option B. Undertake the full diagnostic assessment, including the structured clinical interview, and independently develop a comprehensive treatment plan that encompasses both psychopharmacological and psychotherapeutic interventions, leveraging their understanding of psychopharmacology to guide all aspects of the plan. Option C. Delegate the entire diagnostic assessment and treatment planning process to a psychiatrist. Even though the master psychopharmacologist has extensive knowledge of psychotropic medications and their effects on various mental health conditions. Option D. Focus solely on evaluating the patient's current medication regimen, assessing for potential drug interactions or side effects, and recommending adjustments to the psychopharmacological treatment based on the observed symptoms, while collaborating with a licensed clinical psychologist for the diagnostic assessment and psychotherapy recommendations. Correct answer is D. Focus solely on evaluating the patient's current medication regimen, assessing for potential drug interactions or side effects, and recommending adjustments to the psychopharmacological treatment based on the observed symptoms, while collaborating with a licensed clinical psychologist for the diagnostic assessment and psychotherapy recommendations. Explanation. This scenario presents a professional challenge due to the inherent complexity and evolving nature of psychopharmacology, requiring a practitioner to critically assess the scope of their expertise and the regulatory boundaries within which they operate. The Master Psychopharmacologist, MP, designation implies a high level of competence, but it does not grant unlimited authority or knowledge across all related fields. The core of the challenge lies in distinguishing between the direct application of psychopharmacological principles and the broader domains of psychological assessment, diagnosis, and treatment planning, which may involve other disciplines or require consultation. The correct approach represents best professional practice because it adheres strictly to the defined scope of psychopharmacology as understood within the regulatory framework for the master psychopharmacologist. This involves focusing on the pharmacological aspects of mental health treatment, including understanding drug mechanisms, indications, contraindications, side effects, drug interactions, and the physiological basis of psychiatric disorders. It necessitates recognizing when a situation extends beyond this core expertise and requires collaboration with other professionals, such as clinical psychologists or psychiatrists, who possess specialized knowledge in diagnostic interviewing, psychotherapeutic interventions, or complex differential diagnoses. This approach upholds ethical obligations to practice within one's competence and to prioritize patient safety by ensuring that all aspects of care are addressed by appropriately qualified individuals. An incorrect approach that oversteps the defined scope of psychopharmacology would be to assume expertise in areas such as conducting comprehensive psychological assessments for personality disorders or providing primary psychotherapy without the requisite training and licensure. This failure constitutes a regulatory and ethical breach because it misrepresents one's qualifications and potentially compromises patient care by offering services for which one is not adequately prepared. Such an action violates the principle of practicing within the bounds of one's professional license and certification, as defined by the governing bodies for master psychopharmacologists. It also risks misdiagnosis or inappropriate treatment recommendation, leading to adverse patient outcomes and potential legal repercussions. Another incorrect approach would be to solely rely on pharmacological interventions for conditions that are primarily managed through psychotherapy, neglecting the integrated care model that is often essential for optimal patient outcomes. This demonstrates a misunderstanding of the holistic approach to mental health treatment and the definition of psychopharmacology as a component of, rather than a replacement for, comprehensive mental health care. The professional decision-making process for similar situations should involve a rigorous self-assessment of one's knowledge and skills against the specific requirements and limitations of the master psychopharmacologist designation. When faced with a clinical scenario, a professional should ask, does this task fall directly within the established definition and scope of psychopharmacology as outlined by the MP certification and relevant regulations? If the answer is uncertain or leans towards requiring expertise outside of psychopharmacology, the professional should err on the side of caution, seek consultation with colleagues or supervisors, and refer the patient to other specialists as needed. This iterative process of self-evaluation, adherence to scope of practice, and interdisciplinary collaboration is fundamental to ethical and effective patient care. Question 11. The analysis reveals that a patient with a history of moderate renal impairment and known CYP2D6 poor metabolizer status is being considered for a new selective serotonin reuptake inhibitor (SRI) that is primarily metabolized by CYP2D6 and excreted renally. Which of the following approaches best reflects a risk assessment-driven psychopharmacological strategy for this patient? Option A. Immediately discontinue the SRI and explore alternative treatment options without further pharmacokinetic consideration due to the identified risk factors. Option B. Prescribe the SRI at a reduced starting dose, titrate cautiously based on clinical response and potential adverse effects, and consider therapeutic drug monitoring if available. Option C. Initiate the SRI at the standard starting dose and monitor for adverse effects, adjusting as clinically indicated. Option D. Administer the SRI at the standard dose, assuming that the renal impairment and CYP2D6 status will not significantly impact the drug's efficacy or safety in this instance. The correct answer is C. Initiate the SRI at the standard starting dose and monitor for adverse effects, adjusting as clinically indicated. Explanation. This scenario presents a professional challenge due to the inherent variability in patient responses to psychopharmacological agents, directly influenced by pharmacokinetic processes. A master psychopharmacologist must navigate these complexities to ensure patient safety and therapeutic efficacy, adhering strictly to the regulatory framework governing their practice. The challenge lies in predicting and managing how a patient's body will absorb, distribute, metabolize, and excrete a medication, as these factors can significantly alter plasma concentrations and thus clinical outcomes. This requires a deep understanding of individual patient factors and drug-specific properties, moving beyond a one-size-fits-all approach. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment of pharmacokinetic factors before and during treatment. This aligns with the ethical imperative to provide patient-centered care and the regulatory requirement to practice within the scope of one's expertise, which includes understanding and applying principles of pharmacokinetics to optimize drug therapy. By considering factors such as age, renal and hepatic function, genetic polymorphisms affecting metabolism, and potential drug-drug interactions, the practitioner is proactively mitigating risks of adverse events and treatment failure. This proactive risk assessment is fundamental to responsible psychopharmacological management. Incorrect approaches fail to meet professional standards and may violate regulatory guidelines by neglecting critical aspects of patient care. One incorrect approach might involve relying solely on standard dosing guidelines without considering individual pharmacokinetic variability. This represents a failure to exercise due diligence and a potential violation of the duty of care, as it ignores known factors that can lead to subtherapeutic or toxic drug levels. Another incorrect approach could be to disregard patient-reported symptoms of altered drug response, attributing them to the underlying condition rather than potential pharmacokinetic issues. This demonstrates a lack of thoroughness in patient assessment and a failure to investigate potential drug-related problems, which could lead to prolonged suffering or harm. A third incorrect approach might be to initiate treatment with a new psychotropic medication without reviewing the patient's current medication list for potential pharmacokinetic interactions, such as those affecting CYP enzyme activity. This oversight can lead to dangerous drug-drug interactions, resulting in unpredictable and potentially severe adverse effects, and is a clear breach of professional responsibility and regulatory expectations for safe prescribing. The professional decision-making process for similar situations should involve a systematic risk assessment framework. This begins with a thorough patient history, including medical conditions affecting drug metabolism and excretion, concurrent medications, and relevant genetic information if available. Next, understanding the specific pharmacokinetic profile of the prescribed medication is crucial, including its primary routes of metabolism and excretion and known interactions. Based on this information, potential risks are identified and strategies for mitigation are developed, such as starting with a lower dose, titrating more slowly, or monitoring drug levels. Ongoing assessment of patient response, including both subjective reports and objective signs, is essential to adjust the treatment plan as needed, always considering pharmacokinetic influences. Question 12. Benchmark analysis indicates that a 55-year-old patient previously diagnosed with major depressive disorder, presents with persistent fatigue, diffuse aches, and sleep disturbances. They were previously prescribed amitriptyline, a tricyclic antidepressant, but report inconsistent adherence due to perceived side effects. The patient expresses a desire to feel more like myself, but is hesitant about medication, considering the potential for tricyclic antidepressants to cause anticholinergic, cardiovascular, and sedative side effects. Which of the following represents the most appropriate initial management strategy? Option A. Switch the patient to a different class of antidepressant, such as a selective serotonin reuptake inhibitor, SRI, without a detailed discussion of the previous TCA experience or current symptom specifics. Option B. Prescribe a short-acting benzodiazepine to address the sleep disturbances and diffuse aches, while deferring further discussion about antidepressant management until the patient's immediate discomfort is alleviated. Option C. Conduct a thorough clinical reassessment to understand the specific nature of the somatic complaints, review the patient's history of amitriptyline adherence and side effects, and discuss their current concerns and treatment preferences before considering any medication adjustments. Option D. Immediately reinitiate amitriptyline at the previously effective dose, emphasizing the importance of consistent adherence to manage the current symptoms. The correct answer is C. Conduct a thorough clinical reassessment to understand the specific nature of the somatic complaints, review the patient's history of amitriptyline adherence and side effects, and discuss their current concerns and treatment preferences before considering any medication adjustments. Explanation. Scenario analysis. This scenario presents a common clinical challenge involving a patient with a history of depression and current somatic complaints, where the prescriber must differentiate between a potential relapse and other etiologies. The complexity arises from the patient's non-adherence to a previously prescribed tricyclic antidepressant, TCA, the potential for significant side effects associated with TCAs, and the need to ensure patient safety and therapeutic efficacy within the regulatory framework governing psychopharmacological practice. The prescriber must balance the known risks and benefits of TCAs against alternative treatment strategies, considering the patient's individual response and tolerance. Correct approach analysis. The correct approach involves a thorough reassessment of the patient's current presentation, including a detailed history of their somatic symptoms, a review of their previous TCA treatment response and side effects, and an assessment of their current adherence and understanding of their medication. This aligns with best professional practice by prioritizing a comprehensive diagnostic evaluation before initiating or altering treatment. It respects the patient's autonomy by involving them in the decision-making process and ensuring informed consent. From a regulatory perspective, this approach adheres to guidelines that mandate individualized treatment plans based on thorough patient assessment, emphasizing safety and efficacy. It also implicitly acknowledges the prescriber's responsibility to monitor treatment outcomes and manage potential adverse events, as expected under professional standards. Incorrect approaches analysis. One incorrect approach involves immediately reinitiating the same TCA at a previous dose without a comprehensive reevaluation. This fails to address the patient's current non-adherence and potential reasons for it, and it overlooks the possibility that the previous treatment may not be optimal or that the patient's condition has evolved. Ethically, this could be seen as a failure to provide patient-centered care and could lead to unnecessary exposure to side effects if the patient's current presentation warrants a different therapeutic strategy. Another incorrect approach is to dismiss the somatic complaints as purely psychological without adequate investigation, and to solely focus on restarting the antidepressant. This neglects the potential for underlying medical conditions that could be contributing to the somatic symptoms, a critical oversight in psychopharmacological practice. Regulatory frameworks emphasize a holistic approach to patient care, requiring the exclusion of other medical causes for presenting symptoms. A third incorrect approach is to immediately switch to a different class of antidepressant without first understanding the reasons for non-adherence to the TCA and assessing the patient's current symptom profile. While switching antidepressants is a valid strategy, doing so without a clear rationale based on the patient's history and current presentation can lead to suboptimal treatment and potential adverse drug interactions or side effects. This approach may not be adequately supported by the patient's clinical picture and could be considered a departure from evidence-based practice. Professional reasoning. Professionals should approach such scenarios by first gathering all relevant information: the patient's current symptoms, their history of illness and treatment, their adherence patterns, and any potential contributing factors, medical or psychosocial. This forms the basis for a differential diagnosis. Next, the prescriber should engage in shared decision-making with the patient, discussing the risks and benefits of various treatment options, including continuing, modifying, or discontinuing the current medication, or exploring alternative therapies. This collaborative process ensures that the treatment plan is not only clinically sound, but also acceptable and understandable to the patient, thereby enhancing adherence and therapeutic outcomes. Question 13. Process analysis reveals a patient with a diagnosis of bipolar I disorder, currently maintained on lithium monotherapy with stable therapeutic levels, is presenting with emergent symptoms of acute mania, including increased psychomotor agitation, decreased need for sleep, and grandiose ideation. The clinician must decide on the most appropriate next step in management. Option A. Initiate an atypical antipsychotic as an adjunctive therapy to lithium, with close monitoring for efficacy and potential additive side effects. Option B. Add a selective serotonin reuptake inhibitor, SRI, to the current lithium regimen. Option C. Significantly increase the lithium dose to achieve a higher serum concentration. Option D. Immediately discontinue lithium and initiate a new mood stabilizer as monotherapy. The correct answer is A. Initiate an atypical antipsychotic as an adjunctive therapy to lithium, with close monitoring for efficacy and potential additive side effects. Explanation. This scenario presents a professional challenge due to the need to balance efficacy, potential side effects, and patient-specific factors when managing a patient with bipolar disorder who is experiencing breakthrough manic symptoms while on lithium. The complexity arises from the narrow therapeutic index of lithium, the potential for serious adverse events, and the requirement to adhere to established psychopharmacological guidelines and regulatory frameworks for safe and effective prescribing. Careful judgment, is required to select an appropriate adjunctive or alternative treatment that complements or replaces lithium without compromising patient safety or treatment outcomes. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the patient's current status, including lithium levels, adherence, and the nature of the breakthrough symptoms. It then considers evidence-based adjunctive treatments that are known to be effective in managing manic episodes in patients already on lithium, such as atypical antipsychotics or certain anticonvulsants, while carefully monitoring for potential drug interactions and additive side effects. This approach aligns with the principles of patient-centered care, pharmacovigilance, and the regulatory expectation to use medications judiciously and safely, as outlined in prescribing guidelines and professional standards of practice. An incorrect approach that involves immediately discontinuing lithium and initiating a new monotherapy without a thorough assessment would be a significant regulatory and ethical failure. This could lead to relapse, destabilization of the patient's mood, and potential harm. It bypasses the established protocols for managing treatment resistance or breakthrough symptoms, and demonstrates a lack of due diligence in understanding the patient's specific clinical context. Another incorrect approach, such as increasing the lithium dose significantly without considering the risks of toxicity, would also be a failure, violating the principle of safe dosing and potentially leading to severe adverse events, which is a direct contravention of regulatory requirements for medication management. A third incorrect approach, such as adding a medication with a high risk of serotonin syndrome without careful consideration of the lithium interaction, would also be professionally unacceptable, demonstrating a failure to adequately assess and mitigate drug-drug interactions, a core tenet of safe psychopharmacological practice. The professional decision-making process for similar situations should involve a systematic approach. 1. Reevaluate the diagnosis and current symptom presentation. 2. Assess adherence to current medication and measure relevant laboratory parameters, e.g., lithium levels. 3. Review the patient's medical history for contraindications or comorbidities. 4. Consult evidence-based guidelines and literature for treatment options for breakthrough symptoms in patients on lithium. 5. Consider the risk-benefit profile of potential adjunctive or alternative treatments, including drug interactions and side effect profiles. 6. Engage in shared decision-making with the patient, explaining the rationale for treatment choices and potential outcomes. 7. Implement a robust monitoring plan for efficacy and adverse events. Question 14. During the evaluation of a patient with a history of polysubstance abuse presenting with significant generalized anxiety disorder, which of the following approaches best reflects the master psychopharmacologist's, MP, responsibility in selecting an anxiolytic medication? Option A. Recommend over-the-counter herbal supplements known for their calming effects, as these are generally considered safe for individuals with a history of substance use. Option B. Prioritize non-benzodiazepine anxiolytics with a low potential for dependence and withdrawal, such as buspiron or SRIS/SNRI, after a thorough assessment of the patient's substance use history and current symptoms. Option C. Prescribe a short-acting benzodiazepine for immediate symptom relief, with a plan to taper off within 2 weeks, given the severity of the patient's anxiety. Option D. Select an anxiolytic solely based on its rapid onset of action to quickly alleviate the patient's distress, without extensive consideration of long-term dependence risks. The correct answer is B. Prioritize non-benzodiazepine anxiolytics with a low potential for dependence and withdrawal, such as buspiron or SRIS/SNRI, after a thorough assessment of the patient's substance use history and current symptoms. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the master psychopharmacologist, MP, to balance the immediate need for anxiolytic relief with the long-term implications of medication choice, particularly concerning potential dependence and withdrawal. The patient's history of substance use introduces a significant complicating factor, demanding a nuanced understanding of pharmacodynamics and pharmacokinetics beyond typical anxiolytic prescribing. The MP must navigate the ethical imperative to provide effective treatment while minimizing harm, adhering to the highest standards of patient care and professional conduct as outlined by the master psychopharmacologist, MP regulatory framework. Correct approach analysis. The correct approach prioritizes non-benzodiazepine anxiolytics with a favorable safety profile regarding dependence and withdrawal, such as buspiron or certain SRIS/SNRI, given the patient's history. This aligns with the Master Psychopharmacologist (MP) guidelines emphasizing patient safety, risk mitigation, and evidence-based practice. Specifically, the MP's responsibility includes selecting agents that minimize the risk of exacerbating a substance use disorder or leading to new dependence. A thorough assessment of the patient's substance use history, including the type of substances, duration, and last use, is paramount. The MP must also consider the efficacy of these agents for the specific anxiety presentation, ensuring the chosen medication will adequately address the patient's symptoms without introducing undue risk. This approach reflects a commitment to individualized care and proactive harm reduction, core tenets of the MP's professional obligations. Incorrect approach is analysis. Prescribing a benzodiazepine, even for short-term use, without a robust justification and a clear documented tapering plan, will be a significant regulatory and ethical failure. The Master Psychopharmacologist (MP) framework strongly cautions against benzodiazepine use in individuals with a history of substance use due to the high potential for cross-dependence, abuse, and severe withdrawal symptoms. This approach disregards the patient's specific vulnerability and the established risks, violating the principle of do no harm and failing to adhere to best practices for this patient population. Choosing an anxiolytic solely based on rapid onset of action without considering the long-term dependence profile would also be professionally unacceptable. While rapid relief is desirable, the MP's duty extends to ensuring the chosen treatment does not create a new or worsen an existing problem. This approach prioritizes symptom management over comprehensive patient well-being and risk assessment, which is contrary to the comprehensive care expected of an MP. Recommending over-the-counter herbal supplements without a thorough understanding of their pharmacologic properties, potential interactions with past or current substance use, and evidence of efficacy for significant anxiety disorders would be a failure to provide evidence-based care. The Master Psychopharmacologist (MP) role necessitates the use of treatments with established safety and efficacy profiles, and relying on unproven remedies for a clinical diagnosis of anxiety would be a dereliction of professional duty. Professional reasoning. When faced with a patient with a history of substance use requiring anxiolytic treatment, the MP should initiate a comprehensive assessment. This includes a detailed psychiatric history, a thorough substance use history, and an evaluation of the current anxiety symptoms. The decision-making process should then involve weighing the risks and benefits of various pharmacologic options, with a strong preference for agents that have a lower potential for dependence and withdrawal. This involves consulting current Master Psychopharmacologist (MP) guidelines and relevant literature. A collaborative approach with the patient, discussing treatment options, potential side effects, and the rationale for the chosen medication is also crucial. If a benzodiazepine is deemed absolutely necessary, it should only be for a very limited duration, with a strict, documented tapering schedule and close monitoring for signs of misuse or dependence. Question 15. Strategic planning requires a psychopharmacologist to meticulously evaluate a patient presenting with a complex interplay of anxiety, low mood, and intrusive thoughts. The patient reports significant distress and functional impairment. Which of the following assessment strategies best aligns with the Master Psychopharmacologist (MP) framework for establishing an accurate diagnosis and guiding initial treatment planning? Option A. Immediately prescribing an anxiolytic medication to address the most prominent symptom of anxiety, as reported by the patient, while deferring a comprehensive diagnostic workup. Option B. Relying solely on the patient's self-report of primary symptoms to initiate pharmacotherapy, without further clinical inquiry or objective assessment. Option C. Focusing exclusively on observable behavioral changes during the mental status examination, downplaying the subjective reports of anxiety and low mood as potentially unreliable. Option D. Conducting a thorough biopsychosocial assessment, including a detailed psychiatric history, mental status examination, exploration of symptom onset and trajectory, and consideration of potential co-occurring conditions, before formulating a differential diagnosis and treatment plan. The correct answer is D. Conducting a thorough biopsychosocial assessment, including a detailed psychiatric history, mental status examination, exploration of symptom onset and trajectory, and consideration of potential co-occurring conditions, before formulating a differential diagnosis and treatment plan. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misdiagnosis stemming from a patient's presentation of overlapping symptoms across multiple psychiatric disorders. The psychopharmacologist must navigate the complexities of differential diagnosis, considering the nuances of symptom presentation, patient history, and the impact of potential co-occurring conditions. Failure to accurately assess and diagnose can lead to inappropriate treatment, delayed recovery, and potential harm to the patient. The pressure to provide a timely and effective treatment plan while adhering to rigorous diagnostic criteria necessitates careful judgment. Correct approach analysis. The correct approach emphasizes a comprehensive, multimodal assessment that integrates subjective patient reports with objective clinical observations and relevant collateral information. This aligns with best professional practice as outlined by the Master Psychopharmacologist (MP) framework, which mandates a thorough diagnostic process. This approach ensures that all potential contributing factors to the patient's presentation are considered, leading to a more accurate and individualized treatment plan. It respects the ethical imperative to do no harm by avoiding premature or misdirected interventions. Incorrect approaches analysis. One incorrect approach involves relying solely on the patient's self-reported primary complaint without further exploration. This fails to meet the MP's requirement for a comprehensive assessment and risks overlooking critical diagnostic information. Ethically, it could be considered negligent as it bypasses due diligence in establishing an accurate diagnosis, potentially leading to ineffective or harmful treatment. Another incorrect approach is to immediately initiate pharmacotherapy based on the most prominent symptom without a thorough differential diagnosis. This violates the MP's emphasis on diagnostic accuracy prior to treatment initiation. It represents a failure to adhere to established diagnostic guidelines and ethical principles of evidence-based practice, potentially exposing the patient to unnecessary medication side effects and failing to address the root cause of their distress. A third incorrect approach is to dismiss the patient's subjective experience as unreliable and focus exclusively on observable behaviors. While objective observation is crucial, the MP framework acknowledges the importance of the patient's lived experience in the diagnostic process. Ignoring subjective reports can lead to a fragmented understanding of the patient's condition and a failure to establish therapeutic rapport, which is essential for effective psychopharmacological management. This approach also risks misinterpreting the significance of certain behaviors without the context provided by the patient's internal state. Professional reasoning. Professionals should employ a systematic diagnostic process that begins with a detailed history, including psychiatric, medical, and substance use history. This should be followed by a thorough mental status examination, incorporating both subjective and objective findings. Collateral information from family members or previous treating clinicians, with appropriate consent, can further enhance diagnostic accuracy. The use of validated assessment tools and adherence to current diagnostic manuals, e.g., DSM-5TR, are critical. Professionals must engage in ongoing critical thinking, continuously re-evaluating the diagnostic formulation as new information emerges and considering alternative diagnoses. This iterative process ensures that treatment decisions are based on the most accurate and complete understanding of the patient's condition. Question 16. Quality control measures reveal that a master psychopharmacologist has been prescribing an anxiolytic for a patient experiencing generalized anxiety symptoms, but the treatment plan lacks a documented differential diagnosis and a clear rationale for the specific agent chosen, especially considering the patient's history of mild cognitive impairment. Which of the following approaches best reflects adherence to professional and regulatory standards for psychopharmacological practice? Option A. Prescribe a higher dose of the current anxiolytic to address the patient's reported symptom severity, assuming the initial choice was appropriate. Option B. Switch to a different anxiolytic with a stronger sedative effect, believing this will better manage the patient's anxiety and cognitive concerns. Option C. Continue the current anxiolytic prescription while initiating a comprehensive diagnostic workup and reassessing the medication's appropriateness based on emerging findings and patient response. Option D. Immediately discontinue the anxiolytic and initiate a non-pharmacological intervention, as the current prescription lacks sufficient justification. The correct answer is D. Immediately discontinue the anxiolytic and initiate a non-pharmacological intervention, as the current prescription lacks sufficient justification. Explanation. This scenario presents a professional challenge due to the inherent complexities of psychopharmacological practice, particularly concerning anxiolytics. The challenge lies in balancing patient-specific needs with adherence to established clinical guidelines and regulatory frameworks, while also navigating potential off-label prescribing and the nuances of patient monitoring. Careful judgment is required to ensure patient safety, efficacy of treatment, and compliance with professional standards. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based, and patient-centered strategy. This involves a thorough assessment of the patient's condition, consideration of all available treatment options including non-pharmacological interventions, and a clear understanding of the risks and benefits associated with any chosen medication, including potential off-label use. Adherence to prescribing guidelines, informed consent, and robust monitoring protocols are paramount for ensuring patient well-being and mitigating potential adverse events, aligning with the ethical and regulatory obligations of a master psychopharmacologist. An incorrect approach that involves prescribing an anxiolytic solely based on a patient's self-report of anxiety, without a thorough diagnostic evaluation, fails to meet professional standards. This bypasses the critical step of differential diagnosis, potentially leading to the misattribution of symptoms and the prescription of an inappropriate medication. Ethically, this constitutes a failure to provide adequate care and could result in harm to the patient if the underlying cause of their distress is not addressed. Regulatory frameworks mandate a systematic approach to diagnosis and treatment, which this method neglects. Another incorrect approach, such as prescribing an anxiolytic off-label without a clear rationale, robust supporting evidence, and comprehensive informed consent regarding the experimental nature of the treatment, is also professionally unacceptable. Off-label prescribing is sometimes necessary. It requires a higher degree of caution, documentation, and patient communication. Failure to adequately inform the patient about the lack of established efficacy and safety data for the intended use, and to establish a rigorous monitoring plan for potential adverse effects, violates both ethical principles of patient autonomy and beneficence and regulatory requirements for responsible prescribing. A further incorrect approach, which is to discontinue an anxiolytic abruptly without a tapering schedule, poses significant risks to the patient. Many anxiolytics, particularly benzodiazepines, can cause severe withdrawal symptoms if stopped suddenly. This practice disregards established clinical guidelines for medication discontinuation and demonstrates a lack of understanding of psychopharmacological principles, potentially leading to patient distress and harm. This failure to manage medication withdrawal safely is a clear breach of professional duty. The professional decision-making process for similar situations should involve a systematic multi-step approach. First, conduct a thorough diagnostic assessment to identify the underlying cause of the patient's symptoms. Second, explore all appropriate treatment options, including non-pharmacological interventions, and discuss these with the patient. Third, if pharmacotherapy is indicated, select an anxiolytic based on evidence-based guidelines, patient-specific factors, and a careful risk-benefit analysis. Fourth, obtain fully informed consent, clearly outlining the rationale for the chosen medication, its expected benefits, potential side effects, and alternative treatments. Fifth, establish a clear monitoring plan to assess efficacy, identify adverse events, and manage treatment adjustments. Finally, ensure appropriate medication management, including safe discontinuation strategies when necessary. Question 17. Regulatory review indicates a patient with a diagnosis of major depressive disorder, MDD, presents for a follow-up appointment. The patient reports some improvement, but also expresses concerns about potential side effects and asks about alternative treatment options. The patient is currently taking a stable dose of an SRI and has a history of hypertension managed with a beta blocker. What is the most appropriate next step for the master psychopharmacologist, MP, to consider? Option A. Initiate a discussion about augmenting the current SRI therapy with a second psychotropic medication known to have a low risk of cardiovascular side effects, after a thorough review of the patient's current medication list and medical history for potential interactions. Option B. Advise the patient to discontinue their SRI abruptly and wait for their next scheduled appointment to discuss alternative treatments to avoid any potential additive side effects. Option C. Prescribe a novel psychotropic agent that has shown promise in early research for MDD, without first confirming its safety profile in patients with a history of hypertension or potential interactions with their current SRI and beta blocker. Option D. Immediately switch the patient to a different class of antidepressant, such as a tricyclic antidepressant, TCA, without further investigation into the patient's current medication regimen or specific concerns about side effects. The correct answer is A. Initiate a discussion about augmenting the current SRI therapy with a second psychotropic medication known to have a low risk of cardiovascular side effects, after a thorough review of the patient's current medication list and medical history for potential interactions. Explanation. This scenario presents a professional challenge due to the need to balance evidence-based treatment guidelines with individual patient needs and potential contraindications, all within the strict confines of regulatory compliance for psychopharmacological practice. The Master Psychopharmacologist, MP, must navigate potential drug interactions, patient history, and the nuances of treatment response, ensuring that any therapeutic decision is both clinically sound and legally defensible under the specified regulatory framework. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the patient's current medication regimen and medical history before initiating or modifying treatment for major depressive disorder, MDD. This aligns with regulatory requirements for patient safety, pharmacovigilance, and the ethical obligation to avoid iatrogenic harm. Specifically, it reflects the MP's responsibility to conduct a thorough risk-benefit analysis, considering potential drug-drug interactions and contraindications, thereby upholding the standards of care mandated by the regulatory body governing their practice. An incorrect approach that involves immediately prescribing a new antidepressant without a thorough review of the patient's existing medications and medical history fails to meet the standard of care. This oversight could lead to dangerous drug interactions, adverse events, or exacerbation of existing conditions, violating regulatory mandates for safe prescribing and patient well-being. Another incorrect approach, such as relying solely on patient self-report of medication adherence without objective verification or further inquiry, introduces a significant risk of prescribing based on incomplete or inaccurate information, which is a failure in due diligence and regulatory compliance. Finally, an approach that disregards established treatment guidelines for MDD in favor of an unproven or off-label use without robust justification and informed consent would also be a regulatory and ethical failure, as it deviates from evidence-based practice and potentially exposes the patient to undue risk. Professionals should employ a systematic decision-making process that begins with a complete patient history, including current and past medications, allergies, comorbidities, and previous treatment responses. This is followed by a thorough review of relevant clinical guidelines and pharmacopoeias to identify potential interactions and contraindications. The MP must then engage in shared decision-making with the patient, explaining treatment options, risks, and benefits. Ongoing monitoring and reassessment are crucial to ensure efficacy and safety, with adjustments made based on clinical response and any emergent issues. This structured approach ensures that all prescribing decisions are informed, safe, and compliant with regulatory expectations. Question 18. System analysis indicates that a master psychopharmacologist is evaluating a patient with a complex presentation of treatment-resistant depression and comorbid anxiety. The patient has a history of multiple failed medication trials and expresses concerns about potential side effects. Which of the following approaches best reflects the role of psychopharmacology in treatment planning within the Master Psychopharmacologist, MP, regulatory framework? Option A. Recommend intensive psychotherapy exclusively, deferring any pharmacological interventions until psychotherapy has been attempted for an extended period. Option B. Initiate a trial of a novel antidepressant with a different mechanism of action, carefully monitoring for efficacy and tolerability, while also exploring adjunctive non-pharmacological strategies and considering genetic testing to inform medication selection. Option C. Prescribe the most commonly used antidepressant for depression, assuming it will be effective given the patient's history of treatment resistance. Option D. Focus solely on managing the anxiety symptoms with a benzodiazepine, as this is a readily available and effective short-term solution for immediate symptom relief. The correct answer is B. Initiate a trial of a novel antidepressant with a different mechanism of action, carefully monitoring for efficacy and tolerability, while also exploring adjunctive non-pharmacological strategies and considering genetic testing to inform medication selection. Explanation: this scenario presents a common challenge in psychopharmacology, balancing evidence-based guidelines with individual patient needs and the evolving nature of treatment. The professional challenge lies in synthesizing complex information, considering potential drug interactions, patient comorbidities, and the patient's subjective experience, all while adhering to the Master Psychopharmacologist (MP) regulatory framework. Careful judgment is required to avoid oversimplification or the adoption of a one-size-fits-all approach, which could lead to suboptimal outcomes or adverse events. The correct approach represents best professional practice by prioritizing a comprehensive, individualized treatment plan. This involves a thorough assessment of the patient's current presentation, past treatment history, genetic predispositions, if available and relevant, and potential drug-drug interactions. It emphasizes a collaborative decision-making process with the patient, ensuring informed consent and shared understanding of treatment goals and potential risks. This aligns with the MP's ethical obligations to provide patient-centered care, grounded in the latest scientific evidence and regulatory guidelines for safe and effective psychopharmacological interventions. An incorrect approach that relies solely on a single, widely prescribed medication, without considering the patient's unique profile, fails to meet the standard of care. This could be a regulatory failure if it deviates from established treatment algorithms for specific conditions without clear justification, or an ethical failure if it neglects to explore alternative or adjunctive therapies that might be more suitable. Another incorrect approach, focusing exclusively on non-pharmacological interventions despite clear indications for medication, ignores the established role of psychopharmacology in certain treatment plans and could be considered a failure to provide comprehensive care as outlined by MP guidelines. Finally, an approach that prioritizes rapid symptom suppression over long-term stability and functional recovery overlooks the nuanced goals of psychopharmacological treatment and may not align with the MP's mandate for holistic patient well-being. Professionals should employ a systematic decision-making framework that begins with a thorough diagnostic assessment, followed by a review of current evidence-based guidelines. This framework should then incorporate a detailed patient history, including medical and psychiatric comorbidities, previous medication responses, and personal preferences. A risk-benefit analysis for each potential pharmacological agent, considering interactions and side effect profiles, is crucial. Finally, the treatment plan should be developed collaboratively with the patient, with clear communication regarding expectations, monitoring strategies, and contingency plans for treatment adjustments. Question 19. Compliance review shows a new patient presenting with significant inattentive and hyperactive impulsive symptoms consistent with ADHD. The patient has a history of anxiety but no significant cardiovascular issues. The Master Psychopharmacologist (MP) is considering initiating pharmacotherapy. Which of the following approaches best reflects a mechanism of action-informed, evidence-based strategy for this patient? Option A. Choose a medication based on its popularity and widespread use for ADHD, assuming it will be effective for most patients. Option B. Initiate an atypical antipsychotic medication, as these can have broad effects on neurotransmitter systems and may sedate the patient, potentially improving focus. Option C. Select a stimulant medication known to increase both dopamine and norepinephrine levels in the prefrontal cortex, as these neurotransmitters are central to executive functions affected in ADHD. Option D. Prescribe a non-stimulant medication that primarily targets serotonin reuptake, as serotonin modulation can indirectly influence attention and impulse control. The correct answer is C. Select a stimulant medication known to increase both dopamine and norepinephrine levels in the prefrontal cortex, as these neurotransmitters are central to executive functions affected in ADHD. Explanation: this scenario presents a professional challenge due to the need to balance evidence-based psychopharmacological treatment with the nuances of individual patient response and the potential for off-label prescribing. The Master Psychopharmacologist (MP) must navigate the complexities of ADHD pharmacotherapy, ensuring that treatment decisions are not only clinically sound, but also align with regulatory expectations for safe and effective medication use. Careful judgment is required to select an approach that maximizes therapeutic benefit while minimizing risks, considering the specific mechanisms of action relevant to ADHD. The correct approach represents best professional practice because it prioritizes a thorough understanding of the neurobiological underpinnings of ADHD and how different medication classes target these mechanisms. This allows for a rational, individualized treatment selection based on the patient's specific symptom profile and potential comorbidities. Adhering to established guidelines and considering the evidence for each medication's mechanism of action ensures that treatment is both effective and justifiable within the regulatory framework. This approach emphasizes a data-driven and patient-centered strategy, which is a cornerstone of ethical and competent psychopharmacological practice. An incorrect approach that relies solely on anecdotal evidence or the most commonly prescribed medications without a clear understanding of their mechanisms of action fails to meet the standard of professional care. This could lead to suboptimal treatment outcomes, increased risk of adverse effects, and potential regulatory scrutiny for prescribing without adequate justification. Prescribing a medication without considering its specific mechanism of action in relation to the patient's presentation is a deviation from evidence-based practice and could be construed as negligent. Furthermore, an approach that disregards the potential for drug interactions or contraindications based on the medication's mechanism of action introduces unnecessary patient risk and violates ethical obligations. Do no harm. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's presenting symptoms, a comprehensive review of their medical and psychiatric history, and an understanding of the pharmacological profiles of available treatments. This includes considering the primary neurotransmitter systems implicated in ADHD, dopaminergic and noradrenergic, and how different medications modulate these systems. The MP should then select a medication whose mechanism of action is most likely to address the patient's specific symptom cluster, while also considering potential side effects, comorbidities, and patient preferences. Ongoing monitoring and reassessment are crucial to ensure treatment efficacy and safety, with adjustments made based on observed responses and tolerability. Question 20. Implementation of a revised treatment strategy for a patient with bipolar disorder experiencing breakthrough manic symptoms while on a stable dose of lithium requires a systematic process. Which of the following represents the most appropriate initial step in optimizing this patient's mood stabilization therapy? Option A. Introduce a new psychotropic medication with a known high potential for additive serotonergic effects without a thorough drug interaction review. Option B. Immediately increase the dosage of the current lithium prescription to mitigate the emergent manic symptoms. Option C. Discontinue the current lithium therapy and initiate a different mood stabilizer without a bridging strategy. Option D. Conduct a comprehensive assessment of medication adherence, potential lifestyle triggers, and review of the current lithium pharmacokinetic profile. The correct answer is D. Conduct a comprehensive assessment of medication adherence, potential lifestyle triggers, and review of the current lithium pharmacokinetic profile. Explanation. The scenario presents a common challenge in psychopharmacology, optimizing mood stabilizer therapy for a patient with bipolar disorder who is experiencing breakthrough manic symptoms despite current treatment. This requires a nuanced understanding of pharmacodynamics, pharmacokinetics, patient adherence, and potential drug interactions, all within the strict regulatory framework governing the practice of medicine and prescribing. The challenge lies in balancing efficacy with safety, minimizing side effects, and ensuring patient well-being while adhering to established clinical guidelines and legal requirements. The correct approach involves a systematic, evidence-based evaluation of the patient's current regimen and symptoms. This includes a thorough assessment of adherence, potential contributing factors, e.g., sleep deprivation, substance use, and a review of the pharmacokinetic and pharmacodynamic profiles of the current mood stabilizer. Based on this comprehensive assessment, a carefully considered adjustment to the existing regimen or the addition of a carefully selected adjunctive agent is the most appropriate course of action. This aligns with the principles of patient-centered care, best practice guidelines for bipolar disorder management, and the ethical obligation to provide competent and effective treatment. Regulatory frameworks emphasize the importance of individualized treatment plans, ongoing monitoring, and informed consent, all of which are integral to this approach. An incorrect approach would be to immediately escalate the dose of the current mood stabilizer without a thorough assessment of adherence or other contributing factors. This could lead to increased toxicity and side effects without necessarily addressing the underlying cause of the breakthrough symptoms. Another incorrect approach would be to add a psychotropic medication that has a high risk of drug-drug interactions with the current mood stabilizer without careful consideration of the potential consequences, potentially leading to adverse events or reduced efficacy of either medication. A third incorrect approach would be to discontinue the current mood stabilizer abruptly without a clear rationale or a plan for immediate replacement, which could precipitate a severe mood episode. These approaches fail to adhere to the principles of safe and effective prescribing, potentially violating regulatory requirements for patient safety and professional due diligence. Professionals should approach such situations by first conducting a comprehensive clinical assessment, including a detailed medication history and adherence check. They should then consult current evidence-based guidelines and consider the patient's individual characteristics, comorbidities, and preferences. Decision-making should be a collaborative process with the patient, involving informed consent regarding proposed treatment changes and potential risks and benefits. Continuous monitoring and reevaluation are crucial to ensure treatment effectiveness and safety.